The following Cardio-Oncology Spotlight was recorded at the American College of Cardiology meeting 2025. The meeting title was Advancing the Cardiovascular Care of the Oncology Patient. And there we had a chance to sit down with some of our colleagues who were speaking at the meeting about their individual sessions. We know you're going to enjoy these short but meaningful segments. Thanks for joining us. This is Steve Caselli, Executive Director of the International Cardio-Oncology Society, and I am literally having a fireside chat here with the President of ICOS, Dr. Susan Dent, and our friend and colleague, Dr. Daniel Addison, who is currently Director of Cardio-Oncology at the Ohio State University, the national championship football team this year, but on his way to UT Southwestern in Dallas. So congratulations on that, Daniel. And Daniel will be speaking today about stem cell transplant. So Susan?
Great. Thank you for joining us this morning as we head into our second day at this meeting. You're giving a talk at this meeting around stem cell transplantation, and maybe you could tell us a little bit about what are some of the key components of a comprehensive cardiovascular evaluation for patients preparing for stem cell transplantation, and why is this so crucial?
Increasingly, the number of patients undergoing stem cell transplant is increasing. And this is really because of a number of factors which have increased both the donor pool and the techniques around transplant. However, concurrent to all of this, we've appreciated more and more that cardiovascular disease is actually a key limitation, both before, during, and after the transplant process. It may significantly impact outcomes, particularly survival outcomes in these patients. And so a session really focused around stem cell transplant cardiotoxicity and the cardiac evaluation is timely and key.
So maybe can you sort of give us just a brief overview? What are some of the significant cardiovascular risks that patients undergoing stem cell transplantation face?
So patients undergoing stem cell transplantation face a number of cardiovascular events that may develop over time. These include elements like heart failure, arrhythmia, myocarditis, myocardial infarction, stroke, and even cardiovascular death, as well as ventricular arrhythmias, which again can lead to cardiovascular death.
I think if we think of stem cell transplantation, it's already quite a stress on an individual going through that procedure. And you clearly identified there's many cardiovascular events that they're at risk of. What are some of the strategies or interventions that we can implement before they go under transplantation to try and prevent some of these, cardiovascular toxicities?
The keys are risk factor optimization. So one, stratification of likely risk of event, including arrhythmic event, heart failure event, myocardial infarction, etc. And then increasingly, the data have supported both pre-rehabilitation, like pre-cardiac rehabilitation before transplant, and also after transplant. And that this may help reduce the risk of overall cardiovascular events and potentially even improve cancer-related outcomes over time, or transplant-related outcomes as well.
You bring up rehabilitation, and I think that's so important. In the cardiology world, we know that this has made a huge difference in terms of improving outcomes for individuals with coronary heart disease. And there have been a number of papers now promoting the value of exercise and exercise rehab in patients with cancer. It hasn't been taken up really by that many centers, although increasingly it's important. And I also understand that the funders don't necessarily consider it something that's fundable. So what are your thoughts around that? I mean, it obviously, I think, is growing in importance, but how do we convince sort of the funding agencies and the payers that this is something that we really need to take on for our patients?
I think two key strategies. One, as kind of both clinicians and scientists, showing more outcome data across multiple disease processes where we show both progression as well as survival outcomes to be improved with key strategies of rehabilitation or key strategies of exercise. I think two, also really getting our patients or allowing our patients to truly have a voice and allowing them to advocate. So a thought that's put forward by a patient as far as their need for something like rehabilitation is oftentimes valued very highly by hospital systems and providers. And I know something that, Susan, you're very interested in as well.
Yeah, I think getting patients to advocate with us, I think is so important because payers often will listen to patients, not necessarily to us. So just sort of thinking moving forward, are there any emerging tools or therapies on the horizon that might protect cardiac health in these patients undergoing stem cell transplantation?
Yeah, I think right now the story around the tools are really more comprehensive, like systematic strategies about how to manage the patients both before, during, and after the transplant. These include really early utilization of cardioprotective strategies or cardioprotective therapies, very low thresholds, even in those who are borderline, to implement things like goal-directed medical therapy. And then also, again, constant monitoring for arrhythmic activity, both during and after the transplant process. And then finally, again, within this strategy, incorporation of rehabilitation.
I think so important that we also educate oncology providers, oncologists, hematologists to the value of evaluating patients prior to undergoing stem cell transplantation to try and really ensure that they're not going to have a cardiovascular event, ensure cardiovascular health, and that's going to require, I think, more education. I think probably you would agree.
I fully agree.
Okay. Well, thank you for joining us today, and we're going to let you go, but thank you for taking that time to have this fireside chat with us today.
Thank you for having me.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.